Have you ever watched Star Trek? Remember their concept of a dermal regenerator, which was a device that emitted some form of radiation that seems to stimulate cell regeneration and accelerated healing to the point that you can watch it happen in real time. It was one of the minor but recurring concepts in that series, and we've seen similar ideas in other fictional stories. Well, rapid healing like that may forever exist only in the world of fiction, but in fact, it has been shown that exposure to certain wavelengths of light do indeed accelerate cell regeneration, and can even help heal injury and disease. Maybe not as dramatically as in Star Trek, but enough that it can make a difference. The official term for this phenomenon is photobiomodulation, or PBM, but in practice, it is also commonly known as low-level laser therapy, low-level light therapy, cold laser therapy, non-thermal laser therapy, and several other terms. The constant references to cold or low-level or non-thermal are meant to distinguish this kind of light exposure from far more intense surgical lasers that can actually cut, ablate, and coagulate biological tissues through their powerful thermal effects. That's not what we're talking about here. We're talking about a non-thermal photochemical effect when certain kinds of light interact with living cells. It has been known for decades now that certain biological alterations in animal organisms can be stimulated by means of PBM, using photons of certain wavelengths, namely those in the red or infrared range of about 600 to 1100 nanometers, with an optimal energy delivery of 0.1 to 100 joules per square centimeter. So it is nowhere near as powerful as a surgical laser. The father of modern PBM was the Hungarian physician Dr. Endre Meister, who published his initial research on the stimulating effect of laser light on rat cells in 1968. Since that time, over 3,000 publications with over 150 positive clinical double-blind trials have been published to date. The most critical changes observed in tissues during such light therapy are increased cell replication, increased cell motility or movement, increased cellular metabolism, increased healthy blood vessel production, stimulation of the immune response, and mobilization of stem cells. There is also a reduction of inflammation, evidenced by reduced inflammatory cell signals such as prostaglandin E2, leukocytes, and tumor necrosis factor alpha. When applied clinically and in a proper context, PBM involves a handheld laser emitter or a pad lined with LED light bulbs that radiate in the red and infrared ranges. These light emitters are applied directly to the site of injury. Conditions that can be helped with PBM include acute cutting or abrasion injuries, traumatic soft tissue damage such as to nerves, muscles, tendons, bursae, joints, and bone, osteoarthritis, low back pain, sciatica, diabetic ulcers, bed sores, and surgical sutures. In order to exert a photochemical healing effect, light must be absorbed by some form of photoreceptor molecule within the tissue's cells. Plants have capitalized on this mechanism beautifully. Their photosynthetic tissues contain small organelles called chloroplasts, whose membranes are laid out with special protein complexes that capture the energy of a photon using pigment molecules such as chlorophyll and carotenoids, and then stores the energy for their basic metabolism. Of course, animals like us don't have chloroplasts, but we do have small energy-producing organelles in our cells called mitochondria, which are similarly laid out with a series of proteins that produce adenosine triphosphate, or ATP, our cell's energy currency, using energy derived from pre-existing organic molecules that we would have eaten. This is called the electron transport chain. One component of this series of proteins, an enzyme called cytochrome C oxidase, is most widely accepted as the likely absorption point for the photon energy of PBM therapy. It may not be as efficient or as well adapted to this purpose as the mechanisms we see in plants, but it seems to be enough to create this therapeutic effect. That said, the mechanism by which this process seems to occur is still not completely understood. This has been one of the sticking points that has led to skepticism of the therapy for mainstream use. Further complicating the issue is the requirement of getting a sufficient energy dosage of light to the target tissue, which may be fairly deep in the body if the target is a bone or a tendon. If the person is overweight, a thicker layer of subcutaneous fat may attenuate the light too much before it reaches the target. Similarly, if the person has a darker skin tone, the pigment in their skin may also attenuate the light. And finally, if a person is middle-aged or older, the mitochondria tend to be less efficient than they would be in a younger person, and thus not as reactive to light stimulation. All these conditions require consideration in order to ensure that expectations are set appropriately and that the light intensity and exposure time is sufficient to deliver a therapeutic dose. The dosage may need to be increased, and more treatment sessions required, for some people more so than others for these reasons. However, as many clinicians can attest, light irradiation using this low power density seems to be a non-invasive, non-carcinogenic, non-traumatic procedure that can provide therapeutic benefit to many diseases and medical conditions with few or any side effects.